This current surge of Omicron has created severe stress on Idaho's entire healthcare system.
And couple that with shortages of hospital staff and a blood crisis, and you've got the reasons why we're in trouble. It's also why Idaho Health and Welfare activated crisis standards of care in southwest Idaho.
And CBS 2's Michaela Ellich is live in the studio with more on the challenges the hospitals are facing.
Health leaders say the effects of this Omicron variant is putting tremendous pressure on the health system, causing hospitals and hospital workers to be pushed past their limits. Coronavirus cases across Idaho are at an all-time high, with more than a 30% positivity rate.
We're experiencing the most rapid COVID surge here in Idaho that has occurred during the entire pandemic.
And as cases rise, hospitals are taking a hit, as healthcare workers are strained and struggling to keep up with the growing demand.
I'll call it elasticity of our health system, the ability to continue to stretch staff and to expand into other spaces isn't there the way that it was during surge number 4, in part because of the number of people who are out sick with COVID themselves, and in part because of the fact that they just don't have the physical and emotional capacity to be able to work at the level that they were able to before.
Yesterday, the Idaho Department of Health and Welfare declared crisis standards of care for these 3 health districts: Central, Southwest, and South Central.
It's really fragile everywhere in the state. Clearly we're there here in the 3 districts that we declared, and just right on the edge in the rest of the state. And I would expect the rest of the state to follow suit if the current trends continue.
Another growing concern, a blood shortage.
Blood supply shortage is a national issue that we're very concerned about, and as a result, we've convened a critical blood supply task force with key healthcare partners such as hospitals and blood suppliers serving the state.
Hospitals like St. Alphonsus says that because of the blood shortage, it's now reviewing doctors' requests for blood transfusions.
We are in the process of restricting blood transfusion from an at-will at the doctor's decision point to one where now our blood bank itself is interacting to determine whether it meets very, very stringent and somewhat restrictive criteria.
As more hospitals and health clinics continue to struggle to get the supplies they need, health leaders urge those to get vaccinated and wear a mask.
To this date, with Omicron, of those patients who are hospitalized with COVID, 80% are unvaccinated. 10% are partially vaccinated and 10% are fully vaccinated. The vaccine protects, and if everyone in Idaho were vaccinated, we wouldn't be in this situation.
For those of you wanting to help donate blood, you can head to AmericanRedCrossBlood.org or call 1-800-RED-CROSS. Live in the studio, Michaela Ellich, CBS 2 News.